Good afternoon, everybody. I am super excited to be here today with the guest and the subject we have. We have Dr. Robert Walker. Not only he's a chiropractor by trade. Hold on, they're saying the stream is not going.
You broke it.
Well, no, I see what it's doing. It's not going to the one group, and I don't care. Facebook's been changing everything up. Anyway, Dr. Robert Walker is a licensed chiropractor, and because he's a super overachiever, decided to get not one but two master's degrees. I believe one is in nutrition and one is biochemistry. Is that correct, Dr. Walker?
Yeah, neurochemistry.
Neurochemistry. Okay.
Well, they didn't know what to call it back in the 80s. Now it's into the neuropsychiatry, but it was neuropsychology or brain chemistry.
Yeah, just some light Sunday reading for people. But, today we're going to show how that all intertwines and how it makes sense to make things more of a functional approach. He's the leader of the Exceptional Dental Study Groups, which if you are a healthcare practitioner, especially a dentist or a chiropractor, I can't stress enough what it means to belong to a group like that. It picks up where chiropractic neurology leaves off and explains everything in detail, and you can give the highest level care to people. Your hardest cases become very, very easy. He partners with his wife, Kay MacArthur, and I believe maybe 30 or 40 years of clinical experience in cases.
Since the 80s, way back in the 1900s,
Yeah, so all these new gurus out there claiming to do this, that, and the other thing, they're doing your first level work, and you're already on level 10. So I can't stress that enough. And if it resonates with you, we'll give you some links to hit that up. And I want to hear your story, Dr. Walker. This is what got you here, was the headache situation. So maybe you could let people know about your life and what led you to what you do today.
Yeah, actually, what dictated a whole lot of what I'm did for my entire life was because I had headaches. I had a headache. I had a headache every day of my life from when I was 17 till I was 27. And, it happened when I broke my neck. But so I wanted to learn how to fix my headaches because everything they gave me didn't work. And their attempts were, to slow my brain down or to numb me out or to drug me or to make me feel sick. And I was an athlete like you, Chris. I was a wrestler. That's why I broke my neck. And luckily, back then, it didn't hurt my body. It just gave me a headache. And everybody's saying, well, it can't be your neck because it's your head that hurts. And I'm like going, well, I have a headache. And when I get adjusted, it goes away. Oh, well, that's placebo. And I'm like, yeah, okay. So I went down the whole train of neurochemistry and headaches. And my goal was to be a neurologist or a neurosurgeon to try to fix my headache and to understand it to fix other people's headaches. And the solutions that I was learning going into medical school were they didn't make sense. And it was still like, well, you can't be your neck or anything because it's your head that hurts. And I'm like, well, come on, didn't you guys learn this? And it was so frustrating that I went back to school to get master's degree to kill time to figure out what I wanted to do. And at the same time, I was doing so much on the brain and neurochemistry, I ended up with two. So I ended up with a double bachelor's and a double master's. And then I was ready to go into medical school. And it stopped making total sense. And at that time, I just said, well, the one thing that does work for me consistently is chiropractic. So I'm going to go there. And at that time, I had a field doctor who used to adjust me. And it would work. And he said, well, Bob, you can do a whole lot more than I can do because you already understand nutrition. You understand biochemistry. You understand the brain. You could do so much more with this knowledge than he said that I could ever do. So, well, let's get you in and get you going. And he helped me get in. It was, straightforward because I was already accepted into medical school and stuff. It was like, well, okay, here you go. And he goes, but then I realized that, man, we're going to school a whole 2 semesters more than medical school. So it was like, luckily I got to test out of a lot, but it was a great experience to do research, to do things like that. And I originally started with the Headache Center. That was where we started back in the 1980s, trying to help people with headaches. And then I started to figure them out, and then miraculously got rid of mine. And then that started the whole thing where we are today. You know?
So it sounds like you took some personal adversity and made a career out of it.
No, isn't that what most of us do? I mean, I meet very few chiropractors that don't have the problem that got them into it, just like medical doctors. Just there's always some reason to follow it rather than just passion. It's personal. And when it becomes personal, you tend to learn more because it wasn't about, making the money. It was about helping me and helping other people like me. And I had patients say, well, you don't know what it feels like. And I'm like, yeah, I know exactly what it feels like. And that's why we learn to ask the right questions to get the right answers to help the right people.
Yeah, I think learning to ask the right questions is pivotal of people and help them feel connected. I think suffering leads us to want to dig down a rabbit's hole. I mean, you went down a rabbit's hole that not many people have gone down. Obviously, I think there's a lot of misconception out there in the world, medical or chiropractic. Not I don't want to say not all doctors are equal. They have to have a standard baseline of their knowledge, but you have people that serve the community, and then you have people that serve special problems like you did with the headache. And there's a big difference in the level of care, but I think you have to have a certain level of suffering in order to want to keep digging for that, because it's
to appreciate the problem.
The information you need to understand the simple answer is very complex, and that's what I love about your work is you take very complex things and it's based in neurochemistry and neuroscience, and it's all in the textbooks. There's not anything you've ever said that's not in a textbook, and it applies to how it looks in someone's body and how it expresses their health. Like I know for me, I had a birth trauma where they tugged me out with forceps. They make the head look like a cone shape. You can see my little beaner here, which made my forehead super hard, and hitting people as hard as I could in football field. Did not feel pain ever. Never had a headache on the football field. Like my friends would come back with their face mask sideways, like my head's killing me. I'm like, stop taking Advil, But I couldn't sleep as a kid. My parents would constantly find me sleeping on the floor. I liked it because the floor was cool, because my body was so hot from the inflammation and everything that was going on, and the nervous system not working right. But that kept me cool. And then because I couldn't sleep, when you go out there and ram your head into someone else, the cranial pressure that we talk about for the suture releases in the skull, I would sleep like a baby after a game. So on game day, I couldn't be any more happier knowing I was going to sleep, like pass out, otherwise, I wouldn't be able to sleep like that. And, as an adult, regular chiropractic care helped me, but then, I would get these like ice pick type headaches, and I'm sure we'll get into the different types of headaches and why that happens for people. But to just try to cover something up like that is really dangerous for you. And you could, people get neurodegenerative conditions that can die. So I think this information today is going to be super, super valuable. I had a clinic this morning. I had a gentleman that's been coming here for a while, and he had an ankle reconstruction from a previous injury, and he all of a sudden was getting some bilateral medial ankle pain. And his orthopedic at the last checkup said, oh, it's probably just the joint. And I'm like, no, that's your L4 nerve root, dude. Let's check out what's going on. And, I looked at the skull, and he had a lateral strain of the cranium this way, which was dumping the weight on his SI joint. And then he had to shift the weight to the other side. And then it sheared the disc because, the lateral strains shear the discs in the neck or the lumbar. And it irritated the nerve root bilaterally. And I adjusted him, and he stood up. He's like, whew, that's better, and now I can enjoy my holiday. So sometimes just looking at the symptom is not going to solve the problem, and that's why I think it's important for people.
Rarely does it solve the problem.
Yeah. So when we're dealing with headaches, I think, and you could elaborate on this, we're dealing with some structural stuff sometimes, and then sometimes some metabolic. Is there any other factors?
Well, when you're dealing with headaches, you have to understand that the brain does not have pain receptors, right? So they're right about that. The brain does not hurt. You can open a skull, you can touch the brain, you can make all these things happen, and the brain doesn't hurt. So you have to say, okay, what are the pain sensitive structures in your head? And therefore we have to look at what's going on, what can hurt, and people will describe exactly what's hurting if you understand what to ask. I mean, we have the bones themselves, and the sutures have pain receptors. We know that. That's one of the things with cranial. We also have the dura, the membrane inside, especially where it attaches to the skull on the inside, all those little junctions. All those areas are very, very pain sensitive. We also have the blood vessels. They're very, very pain sensitive. So when somebody's talking about a headache, where does it hurt? What's hurting? And so as clinicians, we have to think, okay, what structures that are pain sensitive are hurting? I mean, there's only a few. And then you look at, okay, what's making them hurt? And that's what we always break most things in the body, including headaches, down to things that are biomechanical, biochemical, or electromagnetic. Now, most headaches are biomechanical in nature. Some are biochemical, like the classic hangover, for instance, or toxic exposure, or sometimes that's mold exposure, or alcohol, toxin. They're all aldehydes. So we look at them as primarily aldehyde exposures. And then you have some electromagnetic things. It tends to be where, when it comes to headaches, we look at more some meridian influences, but I usually put those on the back burner because I consider them to be more triggers than causes. The first thing I'm going to do is say, how much of this is mechanical and how much of this is biochemical? And they'll describe which it is. Though it's hard to have bad headaches without some form of biomechanical issue going on.
So I think that's a great point for people to understand that there's no pain receptors in the brain. A lot of times people like my head hurts, but it's more related to what doctor's saying is it's a biomechanical structure of what supports the brain, biochemical with the aldehydes, and then bioelectrical. Maybe you could talk a little bit about aldehydes. I try to explain this to people a lot of like why it's dangerous to drink alcohol, especially if you've got like cancer or inflammation in your body or in your case history of your life, but they don't seem to fully grasp what I'm talking about with this and what aldehydes actually do and mean to them.
Well, so many things in the body can be that go wrong can be linked to a chemical called an aldehyde. Now, aldehydes come in many shapes and forms, but what the body does with most toxins, in order to detoxify them, there's always a step where you take one of these toxins. We'll take aldehydes and molds because they are very common. Same with a lot of foods. But when we have something that is a toxin, like an alcohol or a mycotoxin, the first step the body will do is to break it apart into, does it like 2 or 3 steps. Generally, it's 2 steps. It will take something like an alcohol and then turn it into an aldehyde. And then it will take that aldehyde and turn it into basically CO2 and water, or will eliminate it as a conjugated aldehyde. That means you just stick something on it to make it neutral so that you can flush it out the urine. Most of these aldehydes will go out the urine. When you drink alcohol, the alcohol has one effect on the nervous system: depressant, respiration. That's what kind of makes you a little bit goofy, goes through those stages. But when a body turns it into an aldehyde, that's what really makes it a toxin and a poison. Now, aldehydes can cross the blood-brain barrier. Aldehydes can go from anything that goes from the liver, the blood, right into the brain, especially through the sinuses. And that's why a lot of inhalant, things like formaldehyde, we know these things can go into the brain, and that's where they're a toxin. And the body has to very much convert that or try to neutralize that aldehyde. And it's the aldehyde that gives you a hangover. It's the aldehyde that gives you brain fog. It's the aldehyde that makes you throw up. It's the aldehyde that causes the problems. We have a mechanism to deal with aldehydes called aldehyde dehydrogenase. We pull off the hydrogen. And that's a good thing. And that's where we then have to stick something else on it, usually a chemical like cysteine or glutathione, to get it out of the body. Now realize this is a step that requires a bunch of enzymes that your body makes. Some people make really good enzymes, and some people make really bad enzymes. That is genetic. And it also requires nutrients for your body to make that to work. You have to have the hydrogens or the oxygens to make this system work. You have to have carbon groups, or what we call methylation, for this to work. And you have to have the proteins like cysteine and glutathione to make this work. So we have the toxins, we have the enzymes that are genetic, and we have the materials for those enzymes to work, which is nutrition. We don't know when somebody comes in with these problems, but you'll see that some people can drink a lot and never get hungover. Some people that can be exposed to aldehydes, like molds and formaldehydes and new carpets and new clothes and things like that. And some, not a problem. And some are super sensitive. That can be genetic and nutritional. So just because somebody doesn't have exposure, has exposure and doesn't have a problem, good for them. Those aren't the people that have these problems. The people that have these problems usually have a form of genetics that don't allow that to work so well. So those are the people we need to help when it comes to aldehydes. But these days, aldehydes, with all the materials that are going on, all the molds that are in the air, there's molds in foods that can cause the same things. Coffee's a big one for that. Beans, grains, these things can all get very moldy. Environment in your house. We all live in hurricane seasons now. You live in a hurricane zone.
I don't want to hear the word. No more water, please.
I live in a hurricane zone, and every year we come back to make sure we don't have water damage. Realize that drywall, plasterboard, has mold in it. It's already loaded with mold. It's just not activated until it gets wet. And that's why when this stuff gets wet, it blooms. That's going to create a lot of problems where you are, just like it is where I live. People go to dry climates to lack the mold, and then they try to turn it into a tropical area like Las Vegas, right? It's the desert, and now they've watered it, and now they have just as much mold and stuff as other places. But mold's a very big issue that some people can handle and some people can't. And when they're doing their rebuilding, if stuff got wet, get rid of it. Sorry, it has sentimental value, and we've seen this way too many times, even in our own world. But if drywall gets wet, even wood and even leather gets wet, it gets mold. And that mold can have a lot of aldehyde issues. That's what mycotoxins are. In the end of the day, is aldehydes.
Yeah, and that leads to cancer. And I was curious, as we're talking about this, if people, in our study group, we talk a lot about sleep on our previous podcasts and things like that. If different type of apneas would be more sensitive to these biochemical ones, like if someone was to have like a central sleep apnea, would they be more sensitive to that versus someone that just had like an obstructive sleep apnea?
Well, aldehydes can affect the immune system, so they can raise inflammation. But we really see it in sleep in two areas. We see it in the central sleep apnea, as you said, because the body has to raise CO2 in order to deal with these toxins. And in order to raise CO2 in the brain, the only way you do that is to hold your breath. And that brings CO2 up. And then you start breathing again until it goes down. And then you have to kind of keep buffering that CO2 in the brain. And hopefully you have glutathione and other things, but CO2 is one of the drivers for helping you to detoxify aldehydes. The other place you see it is when you do the 4 o'clock wake up to go to the bathroom.
Yes.
Wake up at night and you have to pee. It's usually because you have ammonia or aldehydes that are irritating the bladder. At that time, you have to get rid of it so that your body can generate more.
Yeah, on my case histories, that's when I ask people about sleep and they're like, oh, I wake up, and then obviously the next question is what time, and it's usually that time frame. So we're already building a case for essential sleep apnea, and then you get the headache. Oh, do you get a headache when you drink? Type of deal. Eventually, later in this talk, maybe we can get to what are some of the things people could do to help themselves with the biochemical situations like that. Um, Reversing gears here a little bit, going into the bigger part with the structural piece of the headache. Maybe you can elaborate a little bit on some of the things that you've learned over time to look at.
Yeah, rarely do you see chronic headaches being aldehyde, right? Toxic headaches usually follow an exposure. Now, you could be living in a chronic exposure and have this, but it's most headaches that are long in duration have a strong biomechanical basis to it because neurology, I mean, the nerves, right? And the pain sensitive structures that are from the outside in, like the hat band headaches, where it's all round, like you have a vice going on, or whether it's from the back of the head forward, or whether it's behind the eye spiky. I would say 85% of the headaches that present have a mechanical nature with other triggers. Most people just focus on let's control the triggers. And you can drug the triggers, you can avoid food the triggers, you can do low histamine diets for triggers, you can do emotional, you can do acupuncture. These things tend to be triggers. But when it comes down to it, the bulk of what we're dealing with headaches is mechanical. I mean, without a doubt. And that is something that most of the medical industry does not understand because they're not taught it. They're taught to medicate, right? Medicate and keep medicating because you're going to treat a trigger. Whereas the mechanical aspects of it are so important. And the cervical spine is a big chunk, especially when it starts in the back and then it goes from the back forward. Anything that's coming from the back of the head tends to be cervical spine based. When it's in the middle of the head, we know that we can loosen the sutures of the skull, especially when it's a vice type headache. The hat band, that just the pressure's pushing in, that is so cranial. And we know that we can loosen the skull and relieve that so quickly in that type of headache. We get the ones that are in the front that push in and then start here and radiate, or start on one side and radiate. Those tend to be coming a lot from the jaws and the face, the lower jaw and the upper jaw, which is what we call the face. So that area has a lot to do with these ones on the side, those temporalis type headaches. These pushes, it's one side or the other. Even if it has things like a bit of pounding or a bit of spiking. But when it's behind that eye or on the side, either pushing in or pushing out, so much to do with the face. One of the differences when it's right down the midline, it usually has a lot to do with the back. And once again, that dura in the spine. And on your skull, you can see that attachment right there down that frontal bone, right behind the eye, that they tell you where it is. People will tell you what's causing their headache if you ask the right questions and listen. But the structural aspects, we look at the spine, we look at the skull, and we look at the jaws, the joints in the jaws and the occlusion, because they're all related. And when we have traumas to the skull, we affect the whole thing. I mean, for myself, I could get cervical spine adjustments and they would help a lot, but it would come back. And when I started having my skull worked on very early in chiropractic school, I was lucky enough to be around people that were really good at it. And they taught me a lot about the skull, and that would work really well for a while. And then I started to notice that every time I would do that and it would work really well, my teeth wouldn't fit. And I didn't understand what was going on. So then I started to look more at the tooth aspect of it. And my mentor said, we get the skull. We don't know enough about this. That's your job, Bob. You go learn about putting the teeth to the rest of this. And I took that as a challenge right into it and said, okay, let's figure out how the bite bites back. And I had to go learn all about teeth. And in conversations, people think I'm a dentist. No, I just hung around that dental field, which I wasn't really into. But I realized that, oh my God, the plane of occlusion matters to the head. And as an experiment, a dentist friend and I, we artificially just kind of leveled my bite to my brain. And it was probably within 30 minutes, I saw color again that I didn't know I lost for 10 years. My headache went away. The back of my head cleared up. My vision improved. And I went, wow, what the heck's going on? And we kind of laughed about it. And I said, wouldn't it be great if we could make that permanent? Which led me down a whole nother rabbit hole of trying to say, how can we fix the body, fix the skull, fix the teeth to make it level? And luckily, that journey introduced me to Dr. K. MacArthur, my partner, who taught me how to make that work permanently. And so we added a whole nother level of fine-tuned dental care to the structural cranial care, which is what took chirodontics into exceptional dental. And that's where you've been exposed to the end knowledge of 30 years of putting that stuff together from a structural basis. And from doing that, we can deal with probably 80% of the headaches that we see coming in.
Yeah, I can't thank you guys enough. Like, having my own health problems and traditional chiropractic care helped like it did you, but I also soon went to chiro school and wasn't getting that weekly care. I'm like, why is this thing I love failing me? Until I got a better analysis, what I do with my technique with the motion studies and thermography. And, I was fortunate to meet a really awesome chiropractic neurologist and Dr. Michael Hall to teach me like how to do a phys exam that relates to the neuroanatomy, not just someone's system anatomy and what a subluxation looks like and how to measure it. And, most of chiropractic neurology is trying to use the eyes to retrain crooked pathways in the skull, and if you would have told me going into chiro school that the occlusion is the key to all of this, like pain and proprioception as it relates to your jaw, I would tell you you're absolutely crazy. But I will tell you what I see every day, that the jaw is the king to it all to keep you level, and everything that breaks is because that is not doing it. I think you made a great point bridging that gap from the chemical side. So all the literature, I'll read books, I'll read blogs, articles, and everyone's trying to do a biohack for this or that. And they're not looking at the structural side of what's going on. They're just still treating that symptom, even as nauseating it is. There's great people doing things to help people with sleep, but they're focused on circadian rhythms. And there's all this structural stuff that you just broke down up here that you might not even have to deal with that. And obviously they're helping people. I don't want to be critical, but there's a different level to the game. And the more levity to someone's injury, they need to know this stuff, because like a headache may be common, but it's not normal. You don't have to live like this, and like this is what we're trying to express today to everyone, that you don't have to suffer, but you do have to get a qualified practitioner to help you do a good assessment so that we can see what is going on in there, because just focusing on the triggers isn't going to work. And like, I haven't met someone that's got perfect cervical motion that has a cervicogenic headache. It's pretty much impossible to have that.
Right.
Or even better, if they come in and I do some balance test on them, I know that when I motion their neck, something's going to be stuck here because it's not getting the right information to the brain, right? So these are things that go copaesthetic. And, I was hoping maybe we can get into some of the other neural stuff that we'll see, I think, that relate to headaches and the vestibular dysfunction that we'll see. Even other things that are common but not normal, like tinnitus or hearing problems, and how that relates to the structural part with the headache.
Right. Well, as we said before, most of the headaches from a cause standpoint are structural. And from structural, they're either from the neck, the skull, or the teeth. They're all there depending upon what we're hearing. And then we look at triggers, and triggers tend to fall nicely into either traumas, toxic, or tired. The 3 T's of triggers. And before I even, most people play with triggers, as you said, they're trying to manage the triggers of what's going on. Whereas if we deal with the causes, the structural aspects of it, being the cervical spine, which is what we do as chiropractic, then we get to the skull, which the more we have cranial nerve involvement, the more we think about the skull, right? Because the cranial nerves are in the head and they branch out and they'll affect it. That's why one of the things, those little holes in there, all those little holes are where cranial nerves have to exit before they get there. And before they exit those holes, they don't have any coating. There's no insulation or myelin. When they enter through that little hole, there's dura. And that's where they're super sensitive to being pinched. Just like in our spine, where the nerves come out, our cranial nerves do that too. So anytime we start seeing cranial nerves not working properly, we think cranial right away. We know we can change the shape of the skull and immediately affect those cranial nerves, get them back to normal most of the time. That's why the chiropractic neurologists, bless their hearts, still are trying to make your brain work around, rewire. I mean, my master's thesis was on neuroplasticity when they told me it wasn't possible. That was, back in the late 1900s. But now we know those things are true. So now if we see the skull working, we want to get it maximum functioning to get that structural right, and then let the teeth support that. So from our mechanical aspects, we can tell. Now we tell this by, number one, asking the right questions, doing a cranial nerve exam. We can see the amount of cervical versus cranial that's going on. And then on top of that, even from the beginning, we've always added a nutritional layer to make sure that we can deal with the biochemical aspects of it. And those biochemical aspects have to do with traumas, injuries, inflammation, the way the body deals with that. Toxic, how well our body can detoxify, can manage the inflammation, can get other toxins out. Some of that's genetic, for all of it. Some of it's genomic, but I don't focus on genetics first. Genetics loads the gun. Environment and lifestyle pull the trigger. And so there's a lot that we can do to bypass that, making the body strong. And then we get into tired, which is mitochondrial, metabolic based. We see a lot of metabolic dysfunction from what we feed ourselves, from the way the mitochondria work, from do we have the nutrition, do we have the foods, does our brain work on the fuels we give it? Because insulin, people think, the brain always works on glucose. That's just not true. The body's primary fuel is glucose. If you give it glucose, it will prioritize it, because the consequences of not are insulin and a lot of toxic exposure. So we want to maximize our mitochondria in our brain. I mean, Alzheimer's is basically type 3 diabetes. It's a metabolic and toxic dysfunction. The brain doesn't hurt, but the tissues around it, when you have more headaches when you're tired, that's telling you you have metabolic dysfunction in that area. The brain fog that accompanies that has to do with metabolic dysfunction. When we get things like tinnitus, that can be mechanical or chemical. And the chemical always is toxic or tired. So we have toxic, tired, and traumatic tinnitus. How do we know these things? The way they describe them. Anybody out there have tinnitus? A lot of people do. Yep. You say, number one, is it both ears, one ear, other ear, or does it feel like it comes from the middle out? Right? Unilateral, bilateral, central out, or outside in. Is it worse when you're tired? A lot of times it can be, because there's little muscles that attach to the eardrum. Unilateral, when you're tired, has a lot to do with the muscles in the jaws on that side. Another thing we have to look at is, does it change in volume, louder or quieter? Does it change in frequency, higher pitch, lower pitch? All right. When things are variable, it's good. That's a good sign. It comes and goes, it's one side, it changes volume, it changes pitch. Those are all telling you that it's mechanically based. One side that never changes is usually damage, trauma, infection, loud noise, explosions. These things can actually damage the apparatus. When it's both coming out, it's usually central. And central has a lot more to do with the brain stem, which can be structural. Toxic exposure in that auditory cortex part of it. We still don't understand the way, we act like we're smart. We still don't understand vision, smell, hearing. We don't know how those things work. It's a guess. And we base it on responses we get. We don't know. What you hear and what I hear, I have no idea what you hear. I have no idea what you smell. I have no idea what you taste. I have no idea what colors you see. I know because I didn't see colors properly for 10 years of my life, and I didn't know it. I still don't know what colors you see and I see. So it's a guess, right? We don't know. We have to admit that. But we work on what we know. But
I think you're being so honest, and I really hope people are listening to this, because you talk to people and I'm fine, and I can see their faces like this, and I'm like, maybe you're a good compensator, but there's more to your story, and I got to ask you better questions, and I think that's the art of being a good healthcare practitioner, is taking the time to sit and talk with somebody. People go and do a 3-minute exam, that's haphazard. That's not helping you. There's so many other things on the table. And the craziest thing, I don't remember how many anatomy classes I've taken. You probably forgot how many you've taken, but the first chapter of any anatomy book is cranial nerves, without a doubt, right? It's the first one. And every doctor that sits and talks to their patient face to face is looking at the cranial nerves. And they dismiss the cranial nerve problem and treat a symptom that's a trigger from the environment when someone's eyeball is completely crushed, or they're having tinnitus and all these other things, and they're looking right at the problem, which blows my mind how you can't do this cranial nerve exam and better understand it and help people. I would agree the environment plays a role, because I've got a cranial strain like we talked about, and it's a 50-50 shot. If I have 1 or 2 ounces of alcohol, if I get a crazy headache, and sometimes I will get it immediately by drinking. I will be buzzed and have a hangover at the same time, which is absolutely crippling. And it's a 50-50 shot. Worse when I'm tired. So I just don't bother. I'm like, why do I want to feel like crud? But then it's hey, maybe I should get a sleep study. Maybe I got central sleep apnea. Maybe I need to buffer out the ammonia in my system so I don't wind up with type 3 diabetes, Alzheimer's, like people in my family have, or what people happen to have, because it's all these neurodegenerative conditions have a common base in the skull, right? And the CFF fluid. That's the common denominator of all the labels of things. We can sit and label things as a system trigger, but that's really not the problem when the nerves coming through the door are getting pinched and it affects you.
Right. The brain stem matters. And if you don't talk to the brain stem, you don't really see what's going on, because the brain stem doesn't think. The brain stem is not designed to fix itself. The brain stem's designed to survive today so that there is tomorrow. It doesn't care about yesterday. It doesn't care about even an hour from now. It's only right now. It's present time conscious. What does it have to do to survive? And it lets you know a lot of these things. And said some people are awesome at the first step of aldehyde, like taking alcohol to an aldehyde. They don't get drunk, right? They can drink, doesn't affect their function. But man, they can get hangovers, or they go crazy. And a lot of people, they're not drunk, they just kind of lose it. a switch flips, and this is where they'll black out or they won't even remember. It's not like they were drunk. They don't know. And that's aldehyde poisoning. And that's why when people come in here that can't handle aldehydes, you see it. And a lot of those people should not be around it. Now, some people just get the flush, like the Asian flush or the Native American flush. It's
Yes.
because they can't break down aldehydes. That's genetic. And
That would
sometimes,
be labeled as rosacea, right?
well, they get all in the neck and everything else. Everything just, they get red and
Yeah.
flushed. That's aldehydes. And that's why you see that genetically they can't do it. They cannot handle alcohol in that way, or they shouldn't. And I've known people that do, one or two drinks, social, but man, they hit like, it's the old joke about tequila, one tequila, two tequila, three tequila floor.
Yes.
And we see it down here in Mexico. And man, they just boom, the switch goes off, and that's aldehyde poisoning, and they need to stay away from it. Some of these people vomit, some people massive hangovers. That's one of the things that, now, yeah, you can manage that trigger, you can manage that genetics, you can avoid it, you can help support it nutritionally, and all those things are great for triggers. When it comes to headaches, if you don't fix the structure, what are you doing? You can play games about sleep hygiene and balanced body and detoxifying and doing gallbladder flushes, but if you're not dealing with the structural aspect of it, you're dancing around the issue, in my opinion.
I agree wholeheartedly. There's a comedian in New York called David Tell, and he's one of the favorite comedy bits I've ever seen. He calls it time travel. It's like you're drinking, you're blacked out, you're talking to someone, you got a hooded sweatshirt on, somebody's following you. You drink, you black out. One with alcohol, one drink doesn't always, two drinks doesn't equal one all the time. And it depends on your toxic load, your environment, and binge drinking doesn't serve anybody because your body just hits you like kung pao like that.
Yep, that's always an aldehyde load, you know, and you can find the people that are sensitive. I mean, I've seen people go into that full blown toxic shock in a new house. They do all this stuff, or they put in a new kitchen and with fiberboards, like you're going to see, man, people doing the mold, and then they're going to rehab. They're going to put in cheaper quality stuff that's crunched together with formaldehyde, and you're going to see that toxic load come out, and they're going to have formaldehyde poisoning the same way.
Well, that's why I wanted John. I think, I've touched on this in some other talks where I have some environmental conscious friendly builders, and I've given some talks myself. And I was surprised with those particle boards that are compressed. The different glues have urea in it, and you don't want urea in your glue to be breathing it in. And I'm pretty much convinced in the next year or two, we're going to have Hurricane Helene syndrome here. The air quality is still terrible. It's been raining, snowing for months. The ground is still dirty. And now we're going to rebuild with crappy products, and you're going to breathe it in your house, or you're building a new structure that's locked into airtight. The house doesn't breathe enough with these types of glues going on. So we're definitely going to have a new rash of different types of headaches for people that might have been predisposed with a structural strain, and now they're in the environment that is going to, they might have been in a house that was completely off-gassed, right? And then it gets wrecked, and now they're rebuilding.
You're going to see hormonal disruptions as well. You're going to see a lot of things. I mean, I think two things that people in that environment when they're rebuilding should do: put into your budget is a quality water filter and a quality air filter. And, you can get air filters at reasonable prices these days, just some good ones, good types that are out there, Levoit, Winix, some of the ones that sell are not over the top, but they are 3 to 4 to 5 stage, pre-filter, carbon, HEPA. That are going to be able to take a lot of this out of the air, without a doubt. And they'll help do that stuff. And then, because, I mean, you got to do what you got to do to rebuild. And not everybody's going to be ethical and green and these things, but because people that are listening to this, that they've been affected, or even if you're not, doesn't matter where you are, you should control your water source and your air source. I mean, that's within your power to do. And we have multiple locations, and like I said, I come home every year. I try to avoid hurricane season. I come back home and I have to deal with the fallout. But we try to keep air filters going, and we make sure we have clean water and clean air. And then the next goal is clean food. You start with that, and then if you know what's going on nutritionally with your body, you can support your weaknesses. You generally support everything, and then you get picky about supporting your weaknesses. And your weaknesses, we want to make sure the structure is right. We want to make sure that the nutritional is right. Our genomics are supported. We can look at our sleep, and we can look at all the other aspects of our life. I mean, it's a lot of work. Behaviors, belief systems, and lifestyles are the hardest to change. Proper structure working again, control the things you can, and then start to take a look at what you shouldn't be doing, which is always the hardest. Do what you should, and then you'll decide about what you shouldn't.
I joke around. I tell people the stops are free. The stuff you're harming yourself with, you could just stop that for free. But those are the hardest ones to do. I want to definitely jump on the headaches and hormone thing, but I want to finish up with your point about the air and the water. I've been talking about structured water forever. I think it's super important that your water is nutrient dense with minerals. And you mentioned sound like a multi-layer air filter with a HEPA filter on it as well too for people.
Well, if you're going to buy air filter, number one, get a HEPA, just because it's going to have a small enough filtration to pull things out. But HEPA filters will take out particles. But if you want volatile organic compounds, or things that are in the air, which tend to be a lot more aldehyde types, that's where you want activated carbon. So it should always have a carbon layer and then a HEPA layer. In addition, if you're in a house that's got a lot of stuff like that, it should also have a pre-filter that you can just wash and clean, right? A dust, a VOC, and then a HEPA. Most of them have those three. Some of them will have an add-on like ionic or plasma wave, or some kind of ion-based one, which will also be the final step, which kind of charges particles and neutralizes things that are more organochlorines and things of that nature, and mycotoxins. So usually they're 3 to 4, maybe 5-stage filters where you can replace the ones, often HEPAs are most expensive, carbon is next, pre-filters you just clean, and depending on the filter you get. I always like the ones that have separate and the ones that have actual carbon in them rather than just a little membrane, because those will take out more of the volatile compounds along with particles, even viruses. Depends upon how small or how quality the HEPA is.
And should this be detached from your HVAC system or attached to it as part of it, like the intake?
Depends on where you are. Where we live, everything is in mini splits. So there's nothing that's to the whole thing. The ones that get into the whole HEPA system are really good if you can get a good one at the point of entry. You can also just get small ones for the rooms that you're in. They're easier to change the filters, easier to do things. We have one in the kitchen, like to cook with stuff. We also have one in the living room, and we have one in each bedroom. So we just have them. They don't need to be on all the time. They can be on in the daytime, turn it off at night if it's a light. They can be on quiet mode. But if you cook a whole lot, I like to crank it up. If I'm not cooking, I turn it down, because it depends upon what you do. They're separate. They're easier. You have something that breaks, quick filter is easy to change. They're not that expensive. You don't need to go out and buy the thousands of dollar ones. We're talking, Costco type. One decent brand that I've had really good results with is Winix. I don't deal with Winix. I'm not sponsored by Winix. I just have two. Levoit. There's a few of the other ones that are out there. Air Doctors, things like that. See what's available where you are. But it should have a pre-filter, a carbon filter for VOCs, and a HEPA filter minimum. Those three. And then whatever you want to add to the other parts of it.
Yeah, I think that's a great point with the volatile organic compounds. And then also, I love talking about water. I've been talking about this for months since the storm. The water situation here was out of control. I don't trust the testing. I did my own testing, and the chlorine was through the roof even when they were telling people to drink it. But people sometimes forget that water is not the water you drink, it's the water you inhale, because it becomes a gas when you shower. So I was trying to explain to the audience that how important it is to have a shower filter that's not only going to take out the sediments, but you also want to take out the gas nature of the chlorine and breathing that in. That's where I really think is going to be part of this Hurricane Helene syndrome stuff, is the
Oh
inhaled
yeah.
compounds.
And shower filters are so simple. If you have a fixed shower head, they make simple screw-ins. If you have the handheld ones, they make really excellent inline in the spout thing, inline little filters that go in there, and you mount them up there. You can use that to spray if you have that type. Those work excellent as well. I mean, all of our showers have shower filters just because the water is going on you. I mean, whole house filtration can be, I don't want to spend the money to filter my toilet water.
Yeah.
But what you drink and what you put on your skin, most definitely. And it's not out of range. Those are the simple things you can do to take control of your environment, because nobody else is going to do that for you.
And we should have been doing it beforehand, but we definitely need to be doing it now. You know, if you live in hurricane affected areas.
I don't mind that they chlorinate water at a plant, because they have to make it non-pathogenic. That doesn't mean I want to shower in it or drink in it or bathe in it, you know? No, I don't want to. But I understand if they have to get it from a plant through the pipes to your house, they don't want it to be infected. I get that. I don't really have a problem with that. But once it's fluoride in is another thing. It shouldn't even be in there. But the chlorines I get. But take them out. They're not that hard to get out with a simple filtration, point of service, the shower that you use, and the water that you drink. I mean, come on, take control of your environment. Those are things that you can do. They're not telling you not to do stuff. Just do that and help your system out. You know, when it comes to other things, if you feel good, you can be bad. If you feel bad, you need to be good. And you're not the person next to you. So if you say, it doesn't bother me, why does it bother you? You know, bless your heart, because you've got good enzymes. They don't blame them, you know?
I think your statement is we're all an N of one, and we have five. We're, as much as we're similar, we have about 5 different genetic differences that are going to cause us to react to our environment differently.
Yeah, there's always comes down to, there are probably, you could pick out the 5 key genetic variances. I wouldn't call them mutations, because some are actually better. But there's 5 things that'll probably make you totally different than the person next to you, even though we're humans, you know? Because those little changes, whether it's in the brain or the body or the detox or the mitochondria, these are the things that make us different. And you're not going to change that. You just should understand it, support it, and live your best life after you get adjusted, of course.
Yeah. So we touched on this, but we've gone through the neural, biomechanical, the structural, and the chemical, and the electro. What about the hormone factor in this with the headaches?
Well, hormones are going to come into the usually biochemical triggers. Okay. There's a genetic component in them, but I mean, hormones by themselves don't cause pain. You know, they're going to stress the system at certain points. Now, hormone, we'll think right away, classic hormones that'll cause most of the problems, cortisol and insulin, right? I mean, cortisol and insulin are 2 biggies that will do it, and they tend to fall into the tired trigger. We also have all of our digestive hormones, which you got to realize that digestion is a hormonal process just as much as it's an enzyme process. When you eat food, you get a hormone, gastrin. When it goes into the body, you get secretin, acid. When it goes from there into this, you get intergastrone, cholecystokinin, and insulin. All these things are hormones. Glucagon, hormones. They feed back and they tell the body what's going on. So digestion can be a trigger. Cortisol, insulin in the body, big triggers. You also get sex hormones. Now, male sex hormones don't tend to be as cyclical, so we tend not to see the fluctuations. Female hormones do fluctuate, When you have fluctuations in female hormones, your body has to ramp up detoxification of those hormones. Not like it's toxic, but it has to break down estrogen into systems that can get out of the body. Progesterone does that on a lesser level. Surges in estrogen definitely cause the body to upregulate liver pathways that have to do with methylation, because that's how we deal with methyl-based detoxification. If we can't do that, we get things like hydroxyestrogen. So when we look at female hormones, we look at the estrogens, E1, E2, E3, but we also look at what pathways are going on in the body. Are they coming out as methyl or methoxyestrogen, or hydroxylation or hydroxyestrogen? We look at the ratios of those. People that have high hydroxy-based estrogen, much harder on the system, and that basically causes the toxic form of a trigger. So it falls into our same triggers that are going on. Cortisols and digestives have a lot to do with the tired. Estrogen, testosterone, DHEA, those tend to go into the toxic form simply because of the way their breakdown happens. So what are they doing? Toxic or tired? The trauma factors tend to have to do more with inflammation, and that's where we look at our inflammatory markers. So those, to me, fall into the trigger aspect of it. They're very much there. Can we control those triggers and deal with some of these fluctuating headaches? Heck yeah. But once again, look at the structure that's hurting and how can we deal with it? If it's blood vessels that are hurting, the pounding type of a headache, inside out, vascular, that's blood vessel inflammation. Is this toxicity causing blood vessel inflammation? Let's also deal with that blood, that vascular inflammatory response that we're dealing with. How can we mitigate that? So maybe these fluctuations, which are normal, don't cause that trigger.
Interesting. So really, I like what you have mentioned here with the triggers, with the toxic, tired, and trauma. That really helps like solidify what you're taking in someone's case history. So, if your hormones are out of whack and then you have some if you feel you're going to have toxic deload or you're tired, you're playing with a Molotov cocktail. And if you've got a bent up head, you're not going to feel so good. And you're probably going to go get a lot of healthcare tests, and people are going to be like, hey, there's nothing wrong with you. Or you're going to get instead of a bag of drugs, you get a bag of supplements, and you might feel 50% better. But I hope if you're listening to the big point, like Dr. Walker's saying, like 80% is going to be this mechanical dysfunction in the skull as it relates to the occlusion.
Yep. And when it comes to those triggers, if you're talking about nutrition, when it comes to toxic triggers, the toxic triggers for the brain, the best is glutathione, liposomal glutathione that will help the system work it. When it comes to liver exposures and other things, water soluble, we look at cysteine or N-acetylcysteine. Now, cysteine is part of what makes glutathione. So if cysteine alone can help aldehyde dehydrogenase, one of the key things, can help cysteine in the liver specifically, can help make glutathione. Now, if you got lots of cysteine and low glutathione because you can't make it, well, then take it. When it comes to a lot of the system like that, when it comes to hormones, you can use a nutritional substance called DIM. But what DIM does, it's actually a normal plant defense mechanism. We won't call it a toxin, but it's a plant chemical defense. But when you take it, what your liver does is the pathway that deals with DIM is the same pathway that deals with estrogen and a lot of hormones. You actually upregulate. The body says, oh, I'm getting DIM every day. I'm going to make more of these pathways in my liver. So it only has so much it can do with energy. It says, I'm going to make this pathway a priority. So then it gets really good at that pathway. So then when you have hormonal fluctuations, a little more, no big deal. I got 25 more pathways working than normal. When estrogen goes down, it says, it loads off. We're still taking a little bit of DIM. It does it. Same thing we do with our immune system with beta glucan, right? Taking beta glucan up regulates white blood cell vigilance. And so we get all these natural killer cells working all the time, whether you need it or not. Those of you that are dealing with immune system dysfunctions. When it comes to tired, we know the keys to tired to mitochondria are B vitamins, especially B1, B2, B3, minerals, especially magnesium and some zinc, copper's involved as well. So minerals, B's and minerals. And then we look at the things that, depending upon what we eat, carnitine for fats, chromium for sugars, CoQ10 kicks in there as well. And so there's things that we can take to boost mitochondrial function. So the tired and the toxic, and for trauma, that's where we make sure that we try to lower the inflammatory response that's going on in the body, the baseline inflammation. We look at our CRPs, we look at the things that help heal vessels. One of the things that just common today with a lot of this traumatic sensitivity of vessels is low cholesterol. I mean, low cholesterol is such a trigger to vascular inflammation. K2, the Ds, the proper fats, the EPA, DHEA, the choline, and you have to have cholesterol. And if your body's like anything below 200, you know you're just setting yourself up for vascular inflammation, brain dysfunction. I mean, all the myelin that's going on, all the insulation is cholesterol. And you can't have a functioning brain or hormonal system or make new membranes without it. And man, you'll see that a lot in questionnaires. And that's one of the triggers that also sets up this inflammatory, or what we would call in the trauma spectrum of headaches.
I think that's a great point. People forget cholesterol is a steroid hormone. It's a precursor to all the building blocks in your body. And I'll see a lot of people come in here that virtue signal and want to be vegetarians, which is great. I think there's certain blood types that can tolerate that, but a lot of the ones I meet cannot. And, they're not eating enough fats to make cholesterol. And then obviously people fall into this medical triad of, we've talked about it in the courses, of a pill for this and a pill for this side effect of that and this and that and the other thing. And like, people are like, well, what? I eat meat every day, like a pound. I don't know. I'll just eat till I feel full. Like, and like, what's your cholesterol? I'm like, I hope it's over 300. I don't care. Like, I just know that I feel better when I eat this stuff. And then we look at people that are on cholesterol drugs and their health factors, and they're not doing so good.
Yep. The pillage, pilfer, and plunder, it just doesn't work as a healthcare strategy. You're robbing one thing that came from the other, and then you just start taking a pill for this and a pill for that, and then you deal with the fallout. It's just like, plunder, pilfer, and perish is the cycle most people go through.
Yeah. So just what are some of the common misconceptions you've learned through your years of studying headaches, and what are people doing out there that's not helping them even though they think it is?
Number one, people that have headaches, I get it. I totally get it. And you're not alone. It's more common than you think, but people that have headaches do tend to seek care. And number one thing they'll be given is a painkiller. Most painkillers don't work on the brain because the brain doesn't work the same. We don't have these ways to inhibit pain that we do with our spine, our joints, our knees. It's not like you can rub a cream on your skull and make a headache go away. It doesn't work that way. And when we start to get headaches, think about, number one, it's not normal to have head pain. What's hurting? And if you can put your finger on it or you can describe it, then you could describe it to somebody else. Now, if somebody asks the right questions, then you can basically define what's hurting. There's only the three structures that hurt, right? And so what is hurting in your head? Is it the dura? Is it the blood vessel? Or is it the bony sutural joints? So is it a joint, like the skull, the jaws, these things, muscles pushing in? Is it the blood vessels? They'll pound. Is it the dura that will burn? Is it going from the outside in, or is it going from the inside out? I always look at, like we learned in basic diagnostics, OPPQRST. Remember that boring thing, right? Onset, when did it start? If you know exactly when it starts, it helps. It's always happening. It helps. What makes it better? Palliative. What makes it worse? Provocative. What's the quality of the headache? Pounding, burning, aching, radiating, right? Where specifically? Site, S. Can you put your finger on it? Or is it the inside? It hurts right here, doc. Or right here. It goes around to here, right? Timing. Does it happen when you're tired? Do you end of the day? Do you wake up with it? Is it after you do a specific thing? Is it after working on a computer all day long? Is it, let's say when I wake up in the night with it? Timing. And then we look at radiation, right? Does it start in the back, go forward? Does it go one side to the other? Does it start in the front and go back? What's going on with these things? So we just think about the onset, the palliative, what makes it better, provocative, what makes it worse, the quality, describe it, right? The radiation, the site, and the timing. OPPQRST. Ask those questions. And that's why in clinical practice, this is one case where I don't like to give somebody a form, a questionnaire, and say, fill this out. This is one when you have to take the time, 10 minutes, to sit there and ask the questions. And if you know how to say specifically, this is what I mean by that question. Some of these questions you'll say, does it feel like inside out or outside in? You'll think, well, that's dumb. If you have these headaches, you'll know what I'm talking about. Does it feel like it's pushing out or pushing in? I get it. Is it burning, aching, or throbbing? Okay, it makes a difference. And so when you ask the right question, you'll get the answer that they'll tell you the tissue that's hurting, which will tell you what you need to do to make it go away. And then we can get to triggers and other things like that. But to get to the right structure aspect of it, is it the neck? Is it the skull? Is it the teeth? Which of those structures is causing it? What's causing it to hurt? And what are we going to do about it? So in the end, we can find out why you have it, what tissues hurt, and what are we going to do about it? What's our job? And then what's your job? And are you willing to do your job? If you expect me to do mine, you should do yours. Fair enough.
So you've learned it's actually better for you to sit and talk to somebody and ask them the question to explain it versus them filling out some form online and submitting it.
Oh, by far. If you just take that 10 minutes to ask them the question, it's not even 10 minutes. After a while, it can go pretty fast. You can do it in passing. Sometimes I'll start asking the questions. If I know they're coming for that reason, I'll ask the questions kind of while I'm doing a cranial nerve exam.
Yeah, so obviously, you've been in the game for a while. Your study group, you're talking about hundreds of thousands of hours in cases and discussions, and just to shed some light onto people, like what is one thing you would have done different from that now?
Not think I had all the answers, because you learn. Life's learning, and when you've been around it, you see it. I could always empathize. A lot of doctors can't empathize with headaches because they've never had them. I totally get it. Like I said, every day for 10 years, I had a headache. The lowest it ever got was probably a 4, and 10s were no fun. 8s, so common that it didn't even matter. 5s, yeah. 0, are you kidding me? It's like, no, I didn't do that stuff. So empathy is one thing. If you're somebody that's never had it, maybe I don't wish it on anybody, but realize that it does hurt. what I learned of all the times of making it too complicated is that there's only 3 or 4 structures that hurt, right? So let's just get down to brass tacks. There's only 3 or 4 structures that hurt. Most of it has a structural basis. Get our structures coming out of it. Dentists have to realize there's a skull and a neck. Chiropractors have to realize there's a skull and teeth. And it's that whole thing that you're treating. And you have the whole spine. People land on their butts snowboarding, will come up with a frontal headache because they yank that dura so hard that it just rips away the front here. And they get an inside burning headache that's worse on inhalation than exhalation. And it's because they landed on their butt. And very common, And if you just focus on the problem and not the whole thing, if you don't look at the forest for the tree, so to say, you'll miss it. And the other thing is that if you understand there's only a few things that cause it, and the triggers can be broken down pretty easily into trauma, toxic, and tired, it'll streamline your treatment so fast rather than getting caught up in there's so many things going on. We have no idea where to start. No, it's not that hard. What's the structure? What's the answer to the questions? What's the trigger? And it makes it easy because you can just go wham. That's what's causing your headache. And okay, that's the first part. And then you got to fix it. And you need the tools to fix it. A lot of people don't have the tools, or you have to have the team that has the tools to fix what's going on if you're going to play in this game. It's not for if all you want to do is, wiggle people's spines and don't go any further, well, then you're probably not listening to this. But if you're a doctor and you're like Chris, then you're taking it another level. And if you want to take it another level, believe me, there's a line waiting anytime you're ready to do this. And if you're a patient that has these problems, we all know somebody that has these problems. Believe me, we know somebody who has these problems. That's when you just have to realize that, I go to somebody, they're not getting it. And if they're not getting the big picture, then it's going to be very frustrating. So it's better to have somebody that understands the entire picture, or a team that does this picture. It's like I said, if you go to a chiropractor, it's your neck. If you go to a medical doctor, it's a drug. If you go to most nutritionists, it's going to be a hormone or a natural painkiller or cortisol or one of these trigger things. Get the structure, get the trigger, and do what you need to do for behaviors and belief systems. And it's not hopeless.
Yeah, I appreciate you breaking it down like that because, I'm a big supporter of collaborative care, but sometimes people come in and they're managing their own case and, oh, my naturopath said this and this guy said that. But meanwhile, the structure is so off, and it's just frustrating because they've trusted this person and they're trying to get well and they're not well. And then sometimes they don't want to listen to you because they've got more trust with the other party. I had an interesting case, and one thing we didn't talk about, we talked about the eyes a little bit, was someone was getting these crazy headaches, and they just changed their eyeglasses.
Yep.
What's your experience with that for people?
Well, they were describing a headache behind the eyes, muscle tension, worse when they're tired, because this has a lot to do with the muscles focusing on the eyes. When you do vision tests, you'll also see some flickering going on. You'll see tired muscles. You'll see usually a tired pupillary response. If pupils don't hold, when they go side to side, you'll see shaking. You'll see whether it's the structure of the head. The shape of the eyeballs is also determined by the shape of the orbit. And so you can also change vision and things behind the eyes. Now, if it's better when they wear their glasses, worse when they're off, things like that, worse when they're reading, when it happens, they led you that the eyes have a lot to do with it. Maybe we should check the eyes, right? Asking the question about the timing would tell you a lot.
Well, this has been outstanding. This is a wealth of information, and we just barely scratched the surface of how this all integrates. I really appreciate your time today, Dr. Walker. I hope everyone shares this information as you're talking with your friends and the subject of health comes up, and dig a little deeper, have some compassion for your friends and about their headaches, and let them know, like, hey, there's traumas tiredness and toxicity that could be playing a role into this. And there is people that want to help, like Dr. Walker and myself, and we have a whole team of people, not only around the country, but around the world, that we all talk all the time and share this information. And we want you to be the well, because it's basically the life effect, right? If you could be a millionaire and do everything you want with a headache, people would probably do it. I know I probably would, but they're pretty debilitating. For me, I know it's affected my relationships with myself, things I want to do for my performance, relationships with, my significant others and my kids, and you can't be present for people. So these are no fun, and they could really have long-term health consequences, So just trying to cover up a headache with a leave every day, I don't think it's not good long-term. You can get very sick, very, very sick. And we see it every day in the 7th and 8th decade of life, stuff that people have been having headaches for 20, 30 years. Like, I don't know about you when you had your headache center, but I'll see a lot of post-concussive syndrome. So people come in, they had a motor vehicle accident 20 years ago. They obviously had a whiplash. Whiplash and headaches go hand in hand, and with concussion as a symptom. The concussion's not gone in 7 days, it's post-concussive, and they'll have 3 or 4 issues in their neurology that are been there for 20 years that they thought was normal. And they come in here, and I'm like, I don't think that we're not doing so good. You came in with neck pain, but you've got balance problems, you got a headache. We need to address this post-concussive stuff. And they're shocked often to find out that they can actually overcome that. They think that is just life after this accident.
Yeah, it's too common, and people learn to live with it because we're told to live with it. And I totally get when people need to do acute things, because when it hurts, yeah, I get it. But as you know, it doesn't work. And when you see a lot of doctors, just always remember, it's like, 3 blindfolded doctors trying to describe an elephant. Depending upon what part of the elephant you're touching, you're going to have a different way to do it. What we need to do is back up and take off the blindfold and see the whole thing for what it is.
Well, there we have it, everybody. Thanks, Dr. Walker, and hopefully we can help change some people's lives.
Well, great talking to you again, Chris, and see you soon, we hope.
Very, very much so.